This is LiveWell Talk on colonoscopy prep. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Colonoscopy prep tends to get a bad rap, but it's a crucial step in ensuring your procedure goes as planned. We also have complementing the procedure, artificial intelligence to detect polyps, but if you don't tolerate the prep and get that completed, it'll influence the quality of the study, artificial intelligence or not. Returning to the podcast today is Dr. Doug Purdy, gastroenterologist with St. Luke's Gastroenterology, to discuss colonoscopy prep. Dr. Purdy, welcome back.
Hey, thanks, Dustin. Good to be here.
Well, I mentioned the artificial intelligence which we have now that can help detect polyps, and artificial intelligence is creeping into everything. Creeping is probably not the best word, but influencing a lot of service lines. But fundamentally, if you don't, no robot's ever going to do the prep for you. You have to do the prep. And a lot of people have this understandable but unrealistic fear of it. And so first of all, could you just give a background why it's important?
Well, it's important to get well cleaned out, because if you're not, there could be stool or other debris covering the lining of the colon and covering up polyps that we want to see and that we could miss if it's not cleaned out well. So yeah, a good prep is crucial to getting a good exam.
Because if you don't get a good prep, you're taking time off work, using resources. It might not be the optimal one to detect cancer.
Right, exactly.
And you and I have talked before how colonoscopies don't detect cancer. They prevent cancer by getting precancerous lesions.
Right.
You want to just quickly touch on the colonoscopy indications of who should have it or whom should have it and how often?
Sure. Well, you could look at it, you could say, is this for diagnostic reasons or what we call screening reasons? There's also something we call surveillance. So diagnostic reasons would be if someone's having a problem, if they're having rectal bleeding, if they're having abdominal pain, change in bowel habits, unexplained weight loss. Those might be reasons to have a colonoscopy. Someone who's had previous history of colon polyps, or if they have inflammatory bowel disease, then they fall into the program of what we call surveillance colonoscopy. And then there's a big category of people, what we call screening. Right now the start of the screening age is 45. So people 45 and older are at higher risk as you get older. So that's usually when we start doing screening colonoscopies at age 45.
Or 10 years before the youngest person in your family that had it, right?
Right. If someone's had colon cancer, say at age 45, then you usually start at least 10 years earlier than that for the children. So you'd start at 35.
Well, how long have you been in practice?
I started here in 94.
I was going to say.
It was 30 years last year, 31 years this July.
What have you learned over that time about the prep?
Well, it's, there's a lot of information in the prep. And after reviewing our prep for this podcast, I realized there's even more information than I realized, actually. So I would say, one thing I would tell patients is, as soon as you get the instructions, read through the instructions. That's very important, because there's a lot of things in there. And there's information in there that requires you to do things sometimes several days before the procedure. For example, people are on all different types of medicines now. A common medicine are the GLP-1s for diabetes, for weight loss, the injectables. And that's something that we recommend holding.
The Ozempic and et cetera.
Yeah. That's something we recommend holding for 7 days before, so that they have to know that well in advance going into it. If they're on certain blood thinners, Plavix that we hold for about 5 days, Coumadin or warfarins, usually 4 days. Other medicines like Xarelto, Brilinta, different things like that, we would hold just maybe a couple days. But it is, it's important to look through those instructions. I also tell patients, if you're not real regular, if you don't go every day or every other day, some people, maybe they only have a bowel movement every 3 days or so. Well, let us know that. We may have to adjust the prep. The standard prep may not work for them.
That makes sense.
Yeah.
What are the steps in preparing for a colonoscopy?
So about 4 days before, we will tell a patient to go on a low fiber, low roughage diet, avoiding like fresh fruits, vegetables, whole wheat breads, nuts, seeds for a good 4 days or more prior to the procedure. Because those are things that kind of go through the GI tract, don't really get very well digested, And if they're not well flushed out, can, cover a polyp and hide a polyp. But also, more importantly, the small nuts and small seeds, they can actually get sucked into the channel of the scope and block the suction channel and make the scope inoperable. And we have to stop the procedure and can't do it if they have a lot of these little nuts and seeds in there.
Really?
So it's critical for 4 days they be on a low roughage diet. And then we usually say, well, the day before, they should be on clear liquids, okay? If you can pour it into a glass and hold it up and like read a newspaper through it, that's usually considered a clear liquid. Things like water, Sprite, 7-Up, apple juice, things like that. And I tell patients, don't just be drinking water or some sort of diet soda. You need to have some sugar in it so you don't get, hypoglycemic that day of clear liquids. You need to have some calories. We usually have diabetics adjust their meds that day before. We usually say half the usual dose the day before, and they don't take any of their diabetes medicines the morning of. Aspirin you can stay on. We don't usually hold aspirin, especially if it's been recommended by a doctor for heart disease prevention or stroke prevention. We don't want them stop and say
secondary prevention,
aspirin or baby aspirin. And blood pressure medicines. A lot of patients will, on their own, without us telling them, they won't take their blood pressure medicine for a day or two, and they come in and their blood pressure's sky high. And there's been rare cases where we've had to cancel the procedure. It's so high. So you can take blood pressure medicine all the way up till the day of the procedure. Even the morning of the procedure, with a drink of water that early that morning, you can take your blood pressure medicine. But we actually start, so clear liquids the day before. About 4 or 5 o'clock the day before, we have them start the prep. And that's usually starting with some Ducalex tablets. They'll take one Ducalex tablet with, and they'll drink 10 ounces of water. They'll wait 10 minutes. They'll take another Ducalex with 10 ounces of water. And then they wait about an hour. Okay? That kind of gets things moving. Not much, but kind of at least gets the ball rolling. And then an hour later, they start drinking that big gallon jug. But we only have them drink a half of it. So half of the gallon the afternoon before, okay? They put away the second half of the gallon back in the fridge, and they're going to drink that the next morning. So that night before, when they're starting that first half gallon, they're pouring a glass, and we want them to drink a glass, maybe 8-ounce glass of water or of prep about every 5 minutes or so. As fast as they can. We'd like them to try to finish it within a couple hours. And then they're kind of done for that evening. Then we still want them to be drinking more clear liquids and stuff that evening, but definitely no food. Right.
There's
no food the rest of that evening. And we tell patients, if you start feeling nauseated, bloated, sometimes they may have to slow it down a little bit. Sometimes getting up, walking around can kind of get things moving. Once you start having bowel movements, those symptoms usually start going away. They start feeling better, less nausea, bloating. Sometimes, we tell them, some patients have said if they drink it through a straw, it doesn't taste as bad because it can be a pretty salty taste. So sometimes drinking it through a straw helps decrease that. Also, sucking on hard candy can decrease like nausea and that. Maybe taking a break, drinking some hot tea can help. And then the next morning, we have them get up early, depending on when their colonoscopy is. Say their colon's at 8 o'clock. Their colonoscopy is at 8 o'clock in the morning. We don't want them drinking anything within 3 hours. So they need to be done drinking by 5 a.m. And we usually say get it drank over a 2-window period. So, if they have an 8 o'clock colon, they need to be done drinking at 5 a.m. Well, they should probably start drinking at 3 a.m. and drink that second half of the gallon, 1 glass every 5 minutes or so over that 2-hour period of time, and then be done by 5 a.m. for the 8 o'clock colonoscopy. And usually, let's say if it's an 8 o'clock colonoscopy, we'll have them come in an hour early. The nurses will get them registered. They'll get them checked in. They'll take some history and physical on them. They'll start an IV, and then we'll be ready to go at the 8 o'clock appointment.
Now, what happens if they're not quite cleaned out that morning?
If they're not cleaned out, they finished the prep, they should let the nurse that's admitting them know. And they'll kind of check the stool if they have a bowel movement and look at it. But if they're just not cleaned out, sometimes we have to push the procedure back a little bit in the morning and have them drink more prep. if they can tell they're just not getting cleaned out that morning, and say their procedure is not till noon, well, we would like them to come in much earlier than they're supposed to, so they can drink more prep at the hospital, so they can get cleaned out. We tell the patients it should be clear yellow, the prep, kind of like Mountain Dew, for it to be completely cleaned out. And one thing I like to remind patients, sometimes we might get a call the night before. Patient may say, I drank the first half gallon, I'm clear yellow, do I need to drink the next morning's prep? And I always tell them absolutely, because what they don't realize is, even though you're cleaned out that night, your body, even though you're not eating that night, your body continues to make a little bit of stool, and it starts coating the right side of your colon with this, brownish, kind of thick, slimy stool that can cover polyps on the right half of the colon. That's what that second dose is that next morning for, to get that cleaned out. It's what we call split dose prep. Back when I first started practice years ago, we gave them all the prep the night before, and we realized, well, they drank all this prep, but there's still not all that cleaned out over here on the right side. So by splitting it in half, drinking half the night before, half the morning of, that second dose of prep the morning of really gets that right side of the colon cleaned out well. So you get a much better exam and better look for polyps.
Interesting. Now, you mentioned getting an IV. They receive sedation. Do they need a driver?
Absolutely. Good question. They need to arrange a driver, some responsible person that's going to be there, because they have to sign for them, because that patient's going to be leaving endo-sedated. So there needs to be a responsible person that will sign for them, take them home, and we recommend really staying with them, being with them till at least the next morning or for 24 hours.
Interesting. Yeah, when I had my colonoscopy, I was sedated afterwards. I had a good nap. And,
Yeah, we like to say, because some people have showed up and they said, we ask if they have a driver, and they say, no, I'm going to arrange a cab. You can't do cabs. You can't do Ubers. You have to have someone there with you that's going to drive you home and just kind of keep an eye on you, just for your safety. Another thing, I remembered, my nurses will sometimes tell the patient, once we schedule you for a procedure, whether it's a colonoscopy or maybe an EGD, it might not be a bad idea to call your insurance company several days in advance. Tell them, my doctor's recommended this for this reason. Is everything okay, on your insurance side, just so there's no surprises.
Yeah, that's good advice there, because there is some insurances, screening versus diagnostic can be a sticky.
Just so that no one's surprised with anything.
And then, so you might be a little sleepy afterwards. You need some supervision. The next day, back to work?
Yeah, should be. We usually say 24 hours. If you have an early morning procedure, then by the next day you should be fine to go. Yeah. Don't want you doing anything the rest of the day after the procedure. We say no alcohol, no pain medicines. Don't do any driving or anything like that. So just take it easy the rest of the day.
Yeah, it's always no driving heavy machinery, which not a lot of us drive heavy machinery.
Right.
But, it's a good thing we're telling them that, right? When we started the podcast, I had mentioned artificial intelligence, how that's influencing colonoscopies. Could you give a little just overview of what we're using?
Sure.
In the scoping suite?
Right. There is this device we have nowadays called the GI Genius. It hooks into the processor of the colonoscope, and it has millions of images of colon polyps in its database. So it's looking at the same screen we are, the same video screen, and it's monitoring that, and it's looking for anything that might look like a polyp. And if it sees anything it thinks it might be a polyp, it'll put a little green box around it. And so it'll alert us to that, and we can look at it and we can confirm or not, is that a polyp, or maybe we have to, it's a little mucus and we wash it and it goes away and there's nothing there. But yeah, it helps us improve our detection of polyps, and it helps to improve what we call our adenoma detection rate. So it's a good addition to the endo unit.
Yeah, and you're being a little humble there, because I know that our team of gastroenterologists have a very high adenoma detection rate, which means you guys are good at what you do.
Well, we try to think so.
Yeah. No, you guys do a great job. Dr. Purdy, thank you again for joining me and informing our listeners about colonoscopy prep and colonoscopies in general. Once again, this is Dr. Douglas Purdy, gastroenterologist at St. Luke's Gastroenterology. To learn more about screening, visit unitypoint.org unitypoint.org/colonoscopy. That's unitypoint.org/colonoscopy. If you've been diagnosed with colon cancer or any type of cancer, call the Nassau Community Cancer Center at 319-558-4876 or visit their website at communitycancercenter.org to learn more about support services and treatment. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.